Good afternoon, everyone. My name is Barry Solomon. I'm on the board of directors for the South Dakota Parkinson Foundation, and it's my honor to introduce our speaker this afternoon. Please welcome Sarah Macon, a registered and licensed dietitian practicing in the Sioux Falls area. Sarah has been with Avera for 4 years, providing personalized, high-quality nutritional care. She holds certification as a nutrition support clinician and currently covers a neuro ICU at Avera McKinnon. Sarah is passionate about the role of nutrition and overall well-being and will be sharing insights today on optimizing nutrition and Parkinson's disease. Please help me welcome Sarah.
Thank you. Hello. Thank you so much for that great introduction. And thank you so much for having me today to be able to speak. It is a privilege to be able to speak in front of you all about how to optimize nutrition in Parkinson's disease. As said, I'm a licensed and registered dietitian. I currently work at Avera McKinnon Hospital, and I have covered the neurointensive care unit there for the last 2 years. I also worked with the multidisciplinary ALS clinic, and I was a part of that team providing nutrition support for those individuals as well. All right, a little bit more about me. I don't have any fun dog pictures to share, but I do have 2 crazy dogs, so they keep me very busy. I have no financial disclosures or conflicts of interest with the presented materials in my presentation today. As said, the objectives of this presentation will be talking about some national nutrition guidelines just as a jumping off point so we can have an understanding of where these recommendations come from, how to know what to eat, and then how does this deviate when we're talking specifically about Parkinson's disease. We'll be talking about particular diets, and when I say diet, I just mean an eating pattern. It's not something that we're implementing for like weight loss purposes, but it's just an eating pattern, a style of eating. So we'll be talking specifically about the Mediterranean and the MIND diet and the associated benefits with Parkinson's disease. We'll also be talking about the gut microbiome, anti-inflammatory and antioxidant foods, and how these play a role in Parkinson's disease. And finally, we'll talk about some nutrition-related barriers that some individuals may be experiencing, and then what we can do about these barriers. So as we know, Parkinson's disease is a neurodegenerative disease resulting from the decreased production of dopamine by the substantia nigra cells in the basal ganglia of the brain. I've talked a lot about, and we've heard a lot today about symptoms that arise with Parkinson's disease, but there are some other symptoms that aren't talked about as often. Specifically in terms of nutrition, we'll focus on dysphagia, swallowing difficulty. How are we able to get the nutrition we need if we're having difficulty with the act of eating, chewing difficulty, having worsening constipation, medication-related side effects in that sense, reflux, gastroparesis. So we'll delve a little bit deeper into these topics as we progress in the context of nutrition. So why am I up here talking about nutrition today? So nutrition, of course, has a massive impact on our daily lives. It affects every part of our body. It's necessary to give ourselves the appropriate energy, calories that we need to keep our body going, all of our micronutrients needed to sustain our normal body functioning. So we need vitamins, minerals, trace elements. And it's important to note that Parkinson's can have an effect on our nutritional status, and we'll talk about that a little bit later on. But when thinking about a chronic illness and something that happens to us and we feel as though there's not a lot of things that we can do to mitigate those symptoms, we can think about nutrition as somewhat of a controllable factor in our lives. So what we choose to eat and drink and put into our bodies can have a positive or a negative effect. So I want to think about nutrition as a positive thing that we can intervene upon. So just some pictures that I'm sure many of you have seen before. The food pyramid, and it's not typically something that we use now to discuss what foods to recommend and what quantity and quality. We focus more so on how to build a balanced plate. So we have the My Plate method there, where we're filling half of our plate with fruits and vegetables, a quarter with protein-containing foods, a quarter with carbohydrate foods, and then having a low-calorie or a hydrating liquid on the side, just as a balanced plate. So I had mentioned some national nutrition recommendations. So where do these come from? The Food and Nutrition Board of National Academies of Sciences, Engineering, and Medicine have determined these dietary reference intakes, which is a recommendation to ensure that individuals are obtaining enough nutrients they need to meet 97 to 98% of their daily needs. So this was created for healthy individuals, but I want to use it as a jumping off point for we know what bodies need to sustain us. We know that we need carbohydrates for brain functioning, micronutrients for enzymatic function in our body. So we'll talk about just an overview and then how those are different, thinking in the context of Parkinson's disease. So just a little bit more information. I want to focus on how, of course, we all need carbohydrates, proteins, fats as our macronutrients, which are things that we need in a larger quantity, and then fiber as well. We need fiber to sustain normal GI functioning, to stay regular. It's also very important for heart health. And we'll talk a little bit farther along in our presentation about specific fiber recommendations, especially if we're experiencing constipation. Another image there, the AMDRs here, which shows that we need not just carbohydrates, protein, and fat, but we need them to be balanced. So 45 to 65% of daily caloric intake from a carbohydrate source. That includes fruits, vegetables, grains, legumes. 10 to 35% from protein, and 25 to 35% from fat sources. And it would take too long to talk about all the micronutrients, of course, that are essential for our functioning, but here's just a list of our water-soluble, fat-soluble vitamins, our micronutrients, our trace elements that we're not able to synthesize ourselves. We need to uptake it from our diet. So eating foods that are rich in these nutrients so that we can continue with our normal body processes. So let's dive deeper into a little bit more specifics about diet recommendations. So I have bolded here the Mediterranean and Mediterranean and MIND diet, which we will talk more about in the context of Parkinson's disease. Then, of course, there's the DASH diet, the other recommendations. You could be hearing lots of different diets, eating patterns, but we're going to focus on those two today. So the Mediterranean diet summarizes traditional eating habits of countries that are bordering the Mediterranean Sea. And these individuals eat a varied diet, typically focused on non-starchy vegetables, whole grains, beans, legumes, nuts, seeds, low-fat, fat-free dairy products, lean meats, and limiting our saturated fats, high-sodium foods, highly processed foods. And eating in this Mediterranean diet pattern has been associated with decreased risk of cardiovascular-related complications, strokes, and even improving brain health. And this is thought to be due to reducing the risk of obesity, high blood pressure, high cholesterol, which all affect our vasculature and ability to feed blood to our brain. So it's recommended eating a Mediterranean-style diet about 3 cups of vegetables a day and 2 cups of fruit. Why does this matter in the context of Parkinson's disease? Just one study here that I'll talk about, an observational study looking at the association with eating a Mediterranean-style diet and patients' reported symptoms and disease progression. Over 1,000 individuals with idiopathic Parkinson's disease were involved in this study. Ages ranges, average age was 63, and the estimated time since diagnosis was about 5.2 years. So investigators had the participants complete a food frequency questionnaire to determine how closely their typical food intake was similar to like Mediterranean-style diet. And they also had self-reported severity of symptoms. So that's what the outcome measures were for this study. And researchers found that individuals that had a more closely associated diet that had higher intakes of fruits, vegetables, whole grains, fish, olive oil, water, coconut oil, had lower rates of Parkinson's disease progression, and they had reported lower self-reported severity scores of their symptoms. So these individuals found that if they had a closer associated diet with a Mediterranean diet, were found to have self-reported improved symptoms. So I had mentioned just some brief food items. I think it's helpful to see it parceled out here in the different food groups. So vegetables, fruit, grains, beans, legumes. What are these types of foods that we're recommending? So low starch vegetables. So of course, everything can be included in a balanced diet, but focusing more on like any sort of broccoli, cauliflower, peppers, low glycemic index fruits, and that just means fruits that don't increase our blood sugar as quickly or as much. So the berries, blackberries, blueberries, whole grains, all the grains there listed are whole grains, so more fiber as well. Beans, legumes, nuts, and seeds. Now we'll focus more on the MIND diet. So the MIND diet is a combination between the Mediterranean diet and the DASH diet. And the DASH diet is dietary approaches to stop hypertension. So these two together create the Mediterranean DASH intervention for neurodegenerative delay. This diet is very similar to that of the Mediterranean diet, wherein we're trying to eat more vegetables, whole grains, beans, legumes, nuts, seeds, low-fat, fat-free dairy products, and then limiting our red meats, limiting sugary sweetened beverages, sweets, of course, everything in moderation, but focusing more on having these on a weekly or daily basis of the foods specific to Mediterranean diet, which I will show a similar slide as I did for the Mediterranean diet with the MIND diet. Again, another study associating MIND diet compliance with Parkinson's disease-related symptoms and outcomes. So this diet, investigators looked at individuals with age range of 59 to 97. These individuals did not have Parkinson's disease at baseline, and they were monitoring yearly to see if there was any symptom progression and if they had any association between following these typical eating patterns that I mentioned here. So the MIND diet, DASH diet, and Mediterranean diet. So researchers found that adherence to the MIND diet, these individuals had decreased risk of Parkinson's disease development and a slower progression of their disease. When looking at the Mediterranean diet, these researchers found that it was marginally associated, so if individuals were eating more of that Mediterranean style diet, it was marginally associated with them having delayed Parkinson's progression. And there was no association found with eating just the DASH diet style of eating and Parkinson's disease progression. So here lays out the food frequency of the daily foods that we want to be intaking if we're following the MIND diet. So eating mostly a vegetable-based diet. Of course, we need other nutrients as well, but focusing on the 3 cups of vegetables a day, emphasizing olive oil, our vegetable oil as extra virgin olive oil, and then doing whole grains as well. And then on a weekly basis, berries, nuts, seeds, legumes, fatty fish, and lean proteins. So I talked about a couple diet eating patterns, nutrition recommendations. What else could be affecting our body and our functioning? And we like to think about the gut a lot, especially in terms of changes that could be happening, adverse effects. So the gut microbiome encompasses all the microbes in our intestines. So some are good, some not so good, not as beneficial for us as hosts, but they have a relationship. And this relationship within the gut also interacts with the brain. So the gut-brain axis is a bidirectional conversation where the gut can affect the brain and the brain can affect the gut. So if the gut is out of whack or in dysbiosis, this can have a negative effect on our brain and our functioning. And we, of course, want to optimize our gut health because then we can make some improvements on our brain health. So what can we do in regards to nutrition to have a beneficial effect on our gut health? What does affect the gut? So a lot of things in our environment and uncontrollable factors can, of course, have an effect. It's not just nutrition, but also if we're in a stressed state, not only physically stressed, psychologically stressed, but food and nutrition-related things that could affect the gut include food additives. So some food additives, antimicrobials, which are added to some food to prevent mold production, could have a negative effect on our gut microbiome. Some things like emulsifiers, which are used as a stabilizing agent in some foods. Some are synthetic, some are naturally occurring. Emulsifiers could have a negative effect on our gut dysbiosis there. And then another additive to food, sucralose or artificial sweetener, could have a negative effect as well. So we want to limit the intake of these foods that we know are correlated with increasing dysbiosis and not as optimal functioning gut. So how do we improve this gut health if we are having some dysbiosis in our gut? We can try to reintroduce those healthy microbes into our gut. So a probiotic is a non-pathogenic organism that when taken in adequate amounts can result in a benefit to us as the host. Not all foods that are considered a probiotic actually are effective. There are a couple things that are necessary for a food to be considered a probiotic. So these microbes, they may claim, say if you're looking at a supplement on the shelf, that there's 1 billion colony-forming units that are alive and active. Well, if they're alive and active when we take them by mouth, that's excellent, but if they're not going to reach our distal intestine all the way through our digestional tract and actually stay alive, we need that to be the case to have the optimal function there. So just do a little bit of research. There's a lot of things on the market. Ask a dietitian, of course, if you have questions about probiotics, but there are some proposed benefits to taking in probiotic-containing foods or supplements. Maintaining our gut lining, increasing the clearance of negative pathogens in our gut, stimulating the innate and acquired immune system, and then also having a role with mucosal serotonin release. As we know, most of the serotonin we produce is within our gut. So if we're optimizing our gut, it can have a beneficial effect on our mood. Some foods that contain probiotics are yogurt, kefir, miso, sauerkraut, some of those fermented food items there. And we don't just need probiotics, we also need prebiotics, which are undigestible sugars that those healthy microbes in our gut eat. And the byproduct of that digestion from those microbes are beneficial to us, the hosts. So some foods that contain prebiotics include garlic, artichokes, asparagus, bananas, and there also contains some soluble fiber in there that we can digest, but the fiber that we're wanting to take in is the fiber that's feeding those good microbes. There's also something called a symbiotic, which is a combination pre and probiotic. And again, there's a lot of different options on the market, but that is something too that could be taken that could have a beneficial effect for you. But it's important to note that a diet that is complex and is varied, so not just eating similar things every single day, is associated with a diverse and healthy microbiome. Now we'll move on to talking about some anti-inflammatory foods. So inflammation is a normal physiological response to stress or injury, but increased or prolonged inflammation can have a negative effect on our blood-brain barrier, and it could contribute to neuroinflammation and could contribute to neurodegenerative diseases. So what can we do in the frame of nutrition when we're talking about food interventions that could help impede this inflammation? So we can introduce some foods that have some anti-inflammatory properties. So that includes foods that contain vitamin C, vitamin D, vitamin E, omega-3 fatty acids, and then some specific food sources. I think it's important for people to recognize, well, what are vitamin C containing foods? What are vitamin E containing foods? So things that are fruit and vegetables that have color. I always say those that have carotenoids and anthocyanins and some anti-inflammatory properties. Our nuts and seeds are those healthy omega-3 fatty acids. So trying to incorporate those into a typical diet. There are some foods that have been found to be neuroprotective. We know these foods can help support healthy brain function by decreasing the systemic inflammation, help maintain normal blood glucose, have heart-healthy benefits, and all these can help improve that blood flow. We want to improve blood flow so that we have good blood flow to the brain. So foods like extra virgin olive oil, which is discussed a lot in the Mediterranean and Mind diet, nuts and seeds, and then cinnamon has also been found to have some beneficial effects, whether it be cinnamon powder, cinnamon extract. It could have some beneficial cognitive effects there. And then antioxidant foods. So we hear a lot about antioxidants, how they affect free radicals, why they're important. So free radicals are an unstable molecule, and it's a byproduct of normal cellular metabolism. Some foods have naturally acquiring antioxidant properties, and it can help eradicate those free radicals. So foods that have naturally acquiring antioxidant properties include artichokes, tomatoes, different fruits and vegetables there, pecans, blackberries, raspberries, blueberries, and again, similar anti-inflammatory foods, it's important to incorporate some of these antioxidant foods as well. Just want to briefly talk about supplements, and I know there's a lot of supplements on the market. I will say, disclaimer, that supplements are not regulated by the FDA. So it's always recommended if you do choose to purchase a supplement that it be third-party tested, so that somebody outside of that company is reviewing to see if there is the actual content of that supplement included in that, if there's any heavy metal byproducts, things like that. So when choosing supplements, just do your research, of course, but when looking through some supplements associated with Parkinson's disease, I found that coenzyme Q10 was something that some individuals were using because of the potential beneficial effects. But in my research, there was no definitively proven benefit with individuals in Parkinson's disease. Of course, speak with your physician, your provider. If you have specific questions about supplements, they may recommend something. It could be patient-specific, so just wanted to briefly discuss these here with you. Glutathione, which is a tripeptide compound, it can have some antioxidant agent activities. And in one study I found it could slightly improve motor function in individuals with Parkinson's disease, but it wasn't without adverse effects, and these individuals were experiencing some adverse GI effects. Vitamin C and vitamin E, as we discussed, have some anti-inflammatory benefits, but of course, when taking any fat-soluble supplements, you want to not take an excessive amount because fat-soluble vitamins do have an upper limit, as do water-soluble, but we don't want to have any toxic levels being taken. And then I wanted to note vitamin B6. Vitamin B6 is required as a cofactor for dopamine decarboxylase, one of the enzymes needed to convert the L-dopa to dopamine. So this vitamin supplement and in food, B6 may expedite the conversion of L-dopa to dopamine before L-dopa reaches the brain. Since dopamine does not cross the blood-brain barrier, this may reduce the amount of dopamine actually transmitted to the brain. So I would reach out to your provider, your physician, if you're wanting to take a supplement such as B6, just to ensure that that would be safe for you. Of course, before starting any supplements or adjusting your dose of current supplements that you're taking, I recommend visiting with your neurologist, your physician, to discuss if there's any safety concerns. So there's a lot of things that could be contributing to nutritional status in Parkinson's disease, and some things that could be negatively affecting us, and things that we want to make sure that we're recognizing and we're not just putting to the wayside if we're really struggling with things like chewing ability, swallowing ability, having dry mouth. So I just wanted to note here that I recognize these symptoms are something individuals could be experiencing, and then just some tips of things that we could do. So if we're having chewing difficulty, could you adjust the texture of your food? Could you adjust the moisture? Could it be more palatable if doing those types of things? Swallowing dysfunction, dysphagia, we'll talk a little bit more in depth later on. Decreased sense of taste or taste changes could be a medication-related side effect. If you're noticing more of a metallic flavor to food, I recommend using like plastic silverware rather than metallic or stainless steel silverware. Cleansing your mouth in between meals or before meals, just to cleanse your palate, do some tongue scraping, just so that you have your palate is cleansed prior to eating. That might have a benefit for you. Esophageal reflux disease, wherein you're refluxing gastric contents into the esophagus, giving you chest pain and discomfort. That could be a symptom. So recommending eating less acidic foods, so not doing as much tomato products, citrus products, and then eating foods that, or choosing to eat less of foods that affect that lower esophageal sphincter, the sphincter from our esophagus to our stomach. So things like peppermint, coffee, chocolate, it can affect that sphincter, and you may notice reflux becoming worse if you choose to eat or drink those types of foods. Gastroparesis, so delayed gastric emptying. Individuals may feel as though food is sitting in the stomach, making them feel bloated, distended, just like uncomfortable and not wanting to eat. So it's recommended to eat a little bit less high-fat or high-fiber foods. These foods are just longer to digest. They take a little bit longer to empty from the stomach, so eating a little bit less of these foods in a meal could help with that gastroparesis symptom. Choosing to eat smaller, more frequent meals rather than 3 large meals in a day, and drinking liquids between meals can help there too. Of course, as individuals have motor symptoms or functions that are affecting their ability to make food for themselves, prepare food, self-feeding ability, I would recommend, of course, visiting with an occupational or physical therapist. If they can recommend any adaptive silverware or recommendations, positioning while eating to make things easier for you, and then if you have a support system, anybody that could help assist with feeding so that you're able to get in the nutrition that you need. Adequate fluid intake and dehydration, which could be associated with worsening swallowing dysfunction. I recommend choosing foods that are higher in fluid content. So our fruits and vegetables are high in water content, trying to eat more of those types of foods, drinking liquids between meals on kind of a scheduled basis, if you will. It's easy to forget that we're thirsty if we continue to not take much for our liquids throughout the day, so just trying to be cognizant of that. And then drug-nutrient interactions, malnutrition, and constipation, we'll talk a little bit more too. So constipation, of course, is a very uncomfortable symptom that could be from decreased physical activity, could be a medication-related side effect, could be related to dehydration. So what can we do to mitigate this symptom? We can increase our soluble fiber intake. So soluble fiber is what helps gelatinize and soften the stool by bringing water into the bowels. So these include foods like apples, bananas, carrots, prunes. These can contain the soluble fibers that will help gelatinize the stool. And then our insoluble fiber, we talked a little bit about when talking about prebiotics. These are foods that add bulk to your stool and helps propel it through your digestive system. So combining soluble and insoluble fiber together and water and a little bit of motility, movement, physical movement will help with the constipation symptoms. Trying to aim for about 25 to 35 grams of fiber per day, but I will say most Americans eat about 15 grams of fiber, so it's not recommended to quickly jump one day 15 grams to 30 grams. You'll likely have GI complications, bloating, abdominal distension, diarrhea, so I recommend going slow, increasing your fiber intake by 1 to 2 grams and see how you tolerate that. And then, of course, making sure we're staying hydrated. So we need the water and the fiber to work together. If we increase the fiber only, your symptoms will likely become worse. So doing what you can to increase your fluid intake, recommended about 8 cups of hydrating fluid per day. So I know a lot of people think, oh, coffee or tea, but actually those are not hydrating liquids. If they're caffeinated, they're a diuretic, so they're not going to increase your fluid. But things like milk, juice, water, electrolyte rehydration drink, Gatorade, things like that. And then anything you can do for physical movement will help with GI motility. Dysphagia, if an individual is experiencing difficulty with swallowing, and it could depend on the phase of the swallow where the individual is struggling, but they may notice pocketing of foods in the cheeks, drooling, choking on food, feeling as though food is getting stuck, weight loss, aspiration, and aspiration is the inhaling of oropharyngeal contents, which can lead to aspiration pneumonia, and that's, of course, something that we want to avoid. So I recommend if you are noticing those signs and symptoms to visit with a speech pathologist. They would be able to identify what phase of the swallow you're having dysfunction and the recommendations, so they can offer strategies for texture changes, viscosity changes to your liquids. Some individuals may need to change the way that they're swallowing, maybe chin tuck method. Everybody's different, but that's who I would recommend you go visit with because they're the experts on swallowing. There could also be some drug-nutrient interactions. So we'll specifically talk about levodopa and MAOI. So levodopa, this medication uses the same carriers as amino acids, so the basic building blocks of protein, and they compete for transport across the blood-brain barrier. This could affect the effectiveness of that medication. So if you or an individual is experiencing on-off syndrome, it may be recommended to limit the amount of protein that you're taking with levodopa or the amount of time you're taking the protein before or after. And again, I would recommend visiting with your provider about this. And this is only specific to the levodopa medication and not combined medications like Sinemet. And then also MAOI medication is an antidepressant medication which blocks the enzyme MAO. And this enzyme breaks down tyramine, which is another amino acid in our diet. If you're unable to break that down, it could cause adverse effects. So we want to limit foods high in tyramine because we can't break those down. So these foods include a lot of cured and dried foods. So we have pickled foods, beer, wine, specifically for fermented foods, cured meats. So if you are taking an MAOI medication, I recommend visiting with your provider as well to see if you do need to limit these types of foods. So we have talked about some barriers to getting adequate nutrition, and this could all culminate and lead to what's called malnutrition. And malnutrition is defined as deficiencies, excess or imbalances in an individual's energy or other nutrient intakes, and it could lead to some severe effects. So signs and symptoms of malnutrition, things to look out for, are decreased muscle and fat mass. We could be noticing unintended weight loss, decreased intakes in general. We could be noticing some abnormal fluid collection, decreased grip strength, and then some other symptoms you could be experiencing are hair loss or hair thinning, weakness, decreased stability, worse than normal, delayed wound healing, and then also issues with immune function. So if we are noticing these things and you're worried that yourself or a family member could be developing malnutrition, what are some interventions that we can do to treat this? And what I typically recommend is choosing calorically dense food and beverages to get more bang for your buck, because of course fruits and vegetables are excellent for us. They have great micronutrients and everything I had discussed, but you have to eat and drink a lot of something containing fruits and vegetables to get the calories that you would compared to, say, a tablespoon of peanut butter. So trying to add more calories and make it more dense so that you yourself don't have to eat as much. It's not as energy requiring to get the nutrients to help with that weight and strength gain. Drinking liquids that contain calories, smoothies, shakes, oral nutrition supplements, they could be something you could incorporate into your diet. Try snacking between meals and snacking with those calorically dense foods, so dried fruits, nuts, seeds, those types of things could be incorporated. And if you've tried all of these things and you're not able to gain weight or gain strength and you're still really struggling to meet your nutrition needs by mouth, visit with your physician or your dietitian if enteral nutrition may be appropriate. And what is enteral nutrition? It could also be called tube feeding. I'm sure most of you have heard about tube feeding, and there is a negative connotation, I would say, with enteral nutrition support or tube feeding. But it is a way for an individual to get the nutrients that they need if they're really struggling to meet their needs by mouth. And some individuals really rely on this route of nutrition to obtain the nutrition that they need. And typically, it's administered through an enteral access device, usually directly into the stomach, and it's a way to obtain calories, protein, water, and medications. But if an individual is really struggling with reflux or with gastroparesis, some individuals do need a feeding tube directly into the small bowel. So they could have a jejunostomy feeding tube. Some pros and cons of enteral nutrition, as I said, it is a reliable route to give ourselves nutrition. And if an individual is receiving nutrition support through a feeding tube, that doesn't mean they're not able to eat and drink by mouth. I think that's another negative connotation with enteral nutrition is if I have a feeding tube, I won't be able to eat. A lot of individuals still enjoy and are able to eat by mouth, but it takes the stress and the burden off of their back for being able to swallow their medications and get enough food and drink, especially fluids and water. So the access device is a way to ensure that they are getting what they need. By doing that, we're supporting normal GI function, absorption, and metabolism. And then, of course, some adverse effects associated with this. An individual may have some GI intolerances, either to their formula or to how things are administered. So, of course, if that is something you are receiving, visit with your dietitian or your provider about your concerns. They may have a decreased sense of autonomy or perceived quality of life. Of course, it's not the normal route of nutrition, receiving it through a feeding tube, but it is a way to ensure that we are getting what we need. So to just wrap it all up into one slide here, some general recommendations. Within Parkinson's disease, we want to be able to ensure we're meeting our daily caloric, macro, and micronutrients. So the macronutrients are carbohydrates, our fats, our proteins, our fiber, and then our vitamins and minerals. So if you do think that you have some gaps in your diet and you want to try a supplement, I do recommend just visiting with your provider, a dietitian, to see what type of multivitamin or vitamin source would be appropriate. Increase your fluid intakes as best you can. Of course, if you need to limit fluid for a certain reason, follow your provider's recommendations, but trying to increase your fluid intake while incorporating more fiber. More fruits, vegetables, whole grains, nuts, seeds. Try swapping butters or margarines for olive oil. And then try some of those probiotic-containing foods as well. So my take-home messages for this presentation here is to think about what we can add to our diet. It's not beneficial for anybody to think about, I have to restrict or avoid XYZ food or beverages. It's more important to think about what can be added to, how can I enrich and make my diet more robust and more balanced. Incorporating more fruits, vegetables, and they don't have to be fresh. It could be canned or frozen. They're just as nutrient valued as if they're a fresh option. Recognizing those nutrition-related complications that we had talked about, and then how can we mitigate those? What interventions can we do? We really want to make sure that we're identifying any barriers and then seeing if anybody is having signs or symptoms of malnutrition and treating that appropriately. And of course, always communicate with your neurologist, your primary care provider, a dietitian, if you have any nutrition-related concerns. Here are my references. And that concludes my presentation.
Do we have any questions for Sarah?
You talked about B6 and the dopamine. Is there a time frame between taking the two that you should try and wait?
Yeah, so I think it's the quantity, the amount that you're taking of the vitamin B6, and probably the timing as well. I don't know exactly if there would be, like, say, an hour or 2 hours. It's typically before or after a medication administration where we would want to take something that could be counteracting the effect. But I would ask specifically with your provider if you're taking a vitamin B6 medication and your L-DOPA, if you need to either avoid taking that supplement altogether or if you can take it, say, 2 hours later or 2 hours before. But I'm not exactly sure on specific timing.
Okay, what is the shelf life of extra virgin olive oil, and should you keep it refrigerated?
So you don't have to keep it refrigerated once opened, but it is recommended to keep in a dark, like kind of a pantry, in the back of a pantry, just because if there's light to it, it could oxidize. And I would check the food label. I would check the label to see, could be 6 months, could be a year, but most extra virgin olive oils, if they're in a lighter glass package, they could oxidize quicker than if they're in the dark glass. So I would choose that one, and I would choose to keep it in a dark corner of your pantry. You could refrigerate it. It won't freeze or solidify in the refrigerator, but that's how I would store mine.
I know that a multivitamin has B6 in it. And I've been taking my multivitamin and my Cinnamate together. Is that something I should be doing differently?
No, I had mentioned it was just an interaction with the L-DOPA medication and not a combined like Cinnamate medication, which contains L-DOPA, but it's a combined medication.
Okay.
I would just check your multivitamin to make sure if it's 100% of your daily recommended B6, that's totally fine. If it's in excess, if it's say 400, 500% of your daily value, I would visit with your provider if you have questions. But we do need B6. It is an essential water-soluble vitamin. But I just specifically with the L-DOPA, not with the Cinnamate, with a combined medication.
Okay.
Does that make sense? I'm sorry, that wasn't very clear. But
I was also told that I should not take my Cinnamate with my protein.
okay, was that your provider recommendation?
Yeah.
Yes, I would continue to follow that because, like I said, of course, the provider is the one who would be making recommendations related to your medication administration. And if they're wanting you to avoid protein with the medication or for a certain amount of hours after, continue to follow that.
Hi.
Hi.
Would you say the Mediterranean diet and the mitochondria diet are very similar?
The mind diet? Or-
Is that the mind?
Yes, yes.
Mitochondria diet?
Yep, so the mind, the DASH diet for like neurodegenerative delay, that diet, the Mediterranean and mind diet.
Oh, that's what the MIND stands
Yes,
for. Okay,
yes.
thank you.
Yeah, they are very similar.
Any other questions?
You had mentioned cinnamon and also turmeric. How much of that would be worthwhile to take a day?
There was, for this study, they were taking, for the study that I had presented there, I believe it was a tablespoon of the cinnamon powder specifically, and then the extract, I don't know the quantity there, but like I said, it was marginally associated with potential benefits, but you could add a teaspoon to things. I would never take anything as like a shot, if you will, of powder, but incorporating a teaspoon into maybe your cinnamon, like your oatmeal or maybe another baked item could have some beneficial effects.
I take a cinnamon supplement, and 1,000 milligrams a day, but that's because I'm a diabetic and I know
Sure.
it's supposed to help with blood sugars.
Sure. Yeah, were you wondering about dosage or if that was appropriate?
I was just kind of answering her question.
Oh, great, good. All right, well, thank you all so much.